In this example, we're going to think about how to go about designing a large survey and the decisions that are made in practice when you're constructing a survey. One of the interesting things about survey design is that it combines so many elements from so many different fields and incorporates concepts from statistics, epidemiology, linguistics, and psychology, as well as business management and operations. You have to think about what's the most efficient way to implement this survey such that people are going to give meaningful responses. In today's example, we're going to look at the demographic health surveys, specifically concentrating on an example from Tanzania. It's a 2007 to 2008 Standard AIDS Indicator Survey. It's also called an AIS survey as an abbreviation. So before getting started, let's get a brief overview of what DHS actually is. From their website, it says that demographic and health surveys are nationally representative household surveys that provide data for a wide range of monitoring and impact evaluation indicators in the areas of population, health, and nutrition. So what this organization does is they travel to countries and they implement these huge country-wide surveys to get information about health and nutrition within a country. Okay, so let's return to our example of the Tanzania AIDS Indicator Survey. And we're going to look at the different elements that went into this survey. So the first thing you really have to think about are, what are the objectives of the survey? To get all of this information, what I did is I went to DHS's website and I downloaded the final survey report from the 2007-2008 survey. And in that report, they state that the primary objectives of this survey were to provide up-to-date information on the prevalence of HIV infection among adults in Tanzania and the prevalence of malaria infection and anemia among young children. So the objectives give us a lot of information about the survey. Number one, it tells us the things that they want to estimate. And secondly, importantly, it specifies what are the target populations for this survey. It's interesting because in this survey we actually have two target populations that we're looking at. First are adults, and we're interested in HIV prevalence and some HIV information among adults. And then the other target population is young children, and we're interested in malaria infection and anemia rates within young children. So now that we've outlined the goals of the survey, we need to figure out how can this survey actually be implemented in practice. So one of the first things you think about is a sampling frame. Once you've specified the target population, you need to think about how can I sample from that target population. So what the DHS did was clever. They used a pre-existing sampling frame that was developed by the National Bureau of Statistics for the 2002 Tanzania census. The sampling frame for the 2007-2008 AIS survey consisted of enumeration areas from this 2002 census. And so essentially they discretized regions from which they could obtain household listings. And this is convenient, so then DHS doesn't have to go in and develop their own enumeration of the population and a list of all the households that are in this population. So this is a very convenient thing to just use a pre-existing sampling frame. And then once they have the frame that they can sample from, they need to come up with a sampling design. And in this case, they used a multi-stage cluster sampling design where they sampled enumeration areas plus households. So what they did is they first started with a whole list of enumeration areas, and they sampled from that. And they sampled 475 enumeration areas. Now, they didn't just randomly sample these enumeration areas. There's actually a little bit of a stratified component to this sampling. Specifically, they sampled 25 enumeration areas from Dar es Salaam, one of the major cities in Tanzania, and then they sampled 18 enumeration areas from each of the remaining regions in Tanzania. So they broke the country into regions and then sampled enumeration areas within regions. So once they had the enumeration areas, then they went in and used simple random sampling of households. They sampled 16 households from Dar es Salaam, and in the remaining regions, they sampled 18 households per region. So you can see it's a relatively complex sampling design. And once they've established the sampling design, then they need to think about how are we going to implement this survey. And this isn't really a linear process. You really have to think about all of these things at the same time. So thinking about implementation, how do you go about asking people the questions and doing the tests to get the information that you want? So in this survey, there were two questionnaires. There was a household questionnaire and an individual questionnaire. And these surveys were implemented in person. They obtained field workers and they trained them for 3 weeks to teach them how to implement this survey in person. So there's 2 questionnaires, and then there's also blood samples. So they take blood samples from adults to test for HIV prevalence, or to test for HIV, and they obtain blood samples from children to look at anemia and malaria prevalence. And again, when you're designing these surveys and deciding what to test for, you really have to think about what exact content do I want to obtain in my survey to get all of the information that I want. So in this case, they obtained household demographics. From adults, in the individual questionnaires, they asked them about knowledge of HIV. They tested for HIV status, and again, they did the blood tests in the children. Now, how you go about designing this questionnaire is also really going to play an impact on what your non-response rates look like. So remember, this was an in-person survey. There were 2 questionnaires and a blood test. So there's multiple levels of non-response that can occur in this survey. There's the household level. So maybe you couldn't find someone at the household that was sampled in this survey. Then that would be a missing household for this survey, and so that counts as non-response. Additionally, maybe you can get inside of the household. Maybe the people say, yes, you can come in our household and ask us the household questionnaire, but we're not going to participate in the individual survey. That's another type of non-response. And third, you may have people who are willing to participate in both questionnaires, but they're not interested in giving blood to test for HIV prevalence or to test for anemia and malaria if it's a child. So one of the most important things to think about when in the design of large surveys is that all of these elements of design are very interrelated. You start out, you outline your objectives and you outline your target population, and you use those things to come up with a survey design. But then you also have to think about, how do I implement my survey and how is that going to impact non-response rates? In this survey, they incorporated a testing component, and maybe that would dissuade people from participating because they're scared of giving blood, etc. So all of these things really come together to produce one final survey, and in the end, you just have to judge the credibility of the survey based on the information that you have. One of the nice things about DHS is they typically have good response rates. In this survey, the household response rate was 97.6%, and the individual response rate was around 96% in women and 88% in men. HIV testing response rates were 90% in women and 80% among men. So response rates were really relatively high for this survey. It was a complex survey, and so when you're analyzing the data, you need to think about survey weighting, etc. But I've just sort of described this to give you an idea of the components that really go into designing a survey in practice. Now, it's very interesting to go in and contrast the DHS AIDS Indicator Survey with this survey that we've looked at in the course in some of the tutorials, namely the California Health Interview Survey. Contrasting these 2 surveys is very interesting because they're so different. So the CHIS survey is a statewide survey, but rather than doing the in-person interviews, they use a random dial telephone survey. So it's conducted completely by telephone. It's conducted on a continuous basis, and they interview people about a wide range of health topics. The goal is to give a detailed picture of health and healthcare needs of Californians, and in a full cycle, they survey over 50,000 Californians. So this is a huge survey. So a few things to think about is, how do they conduct their sampling frame in this case? They need a list of telephone numbers. And then once they have that list, they can go in and they use a stratified random sample to sample people's telephone numbers. Once they have those phone numbers, they use random digit dialing for landlines. And then recently, they've implemented also some random digit dialing for cell phones, which opens up the comparison between landline and cell phones really opens up a whole new can of worms, because you have to think about who has landlines, who has cell phones, is my sample representative? Also, when you're doing telephone surveys, you end up with much lower non-response rates. The DHS takes great care to try to minimize their response rate, but unfortunately with these telephone surveys, people generally are more reluctant to participate. So as an example, in the 2009 CHIS survey, the landline sample household response rate was only 19.7%. What's interesting is, for this CHIS survey, to try to maximize the non-response rate, they mail an advance letter to people whose numbers were sampled for this survey, And in this letter, they include a $2 bill to try to promote cooperation and essentially encourage people to participate in their survey. So this is an incentive, an example of an incentive to participate. Now we've gone through both of these surveys. If you're interested in learning more about them, I encourage you to go to the websites. You can also obtain public use data files from both CHIS and from DHS if you are conducting research. And you can look at the survey reports, you can look at the data. They give you descriptions of how to analyze the data, how to apply the appropriate weights, and how to get correct standard error estimates using various different software programs, including Stata. So I encourage you to go look at the data, look around, and get a feel for how these large surveys are designed in practice.